to PACU Nursing Minutes. Today, we are going to do several different things. I'm going to give you a little update on the course. It's going really, really good. And I'm pretty excited to have it to you here coming up in a short while. I have recorded the respiratory module. I've recorded the cardiac module. I've recorded the neuro module. The other modules that are being edited right now by my editor, and then I will have them recorded. It does take some time to edit the videos and then get it all uploaded onto my platform, but I'm pretty excited. It's coming along and I will have it to you as quickly as I can create it and get it all completed. I will be, though, having some time out of my office going to the ASPAN National Conference. So if you're going to be there this coming weekend, I will be there as well. So please come and say hi and just, I'd love to give you an elbow bump or a hug if you're into hugging, and just say hello. So yeah, great things are moving forward with the course. And also, if you're interested in the course, go to my website, PACU Nursing Minutes. There you can sign up for my updates. I'll be notifying of pre-sale once I know I'm exactly 2 weeks away from having it ready for your viewing. Once I'm 2 weeks away, I will also be announcing when I'm going to have the live course. I do expect to have a live course for you before summer, and I'm going to have sessions throughout the summer. And there is going to be a workbook that is coming for the course. It's going to take me some time to publish that. So I'm expecting that, I hope, by July to get that edited and published. So everything takes a lot longer than what I had anticipated all of this to take, but it's all coming together beautifully. And I thank you for your patience. I thank you for your subscribership. So thank you, all of you who watch me on YouTube. You're just great. I thank you for those nurses who send me emails. That is just really makes my day. That is just gives me so much inspiration and joy in what I'm doing and helping you all in your practice. So today I want to talk about corneal abrasions. And corneal abrasions is a problem that we have post-op. And you want to be able to know how to identify it quickly and to treat it quickly to give your patient relief from the pain that they're having from that abrasion on their cornea. So this is a small excerpt from the CPAN certification review course. And I'm just kind of extracting it out and going to give it to you for free here. So if you like what you see here, this is kind of what you can expect in my CPAN course. So stay tuned. We're going to go to the course. A corneal abrasion is a scratch on the cornea. The incidence happens about 1 in every 1,000 surgeries. You can suspect a higher rate with face masking. And the reason why I say that is because I've seen it. And I had tons of corneal abrasions after the onset of mandatory face masking compared to what I had in clinical practice before mandatory face masking. And that is because these masks, they quickly rise up over the face. And if there's nothing protecting the eyes during that recovery phase, that emergence phase, that mask itself can cause an abrasion on the cornea if it gets pushed up over the eyes. So really pay attention to where your face masks are on your patients when they come out of the OR. Make sure it's positioned and it's not riding up into their eye. So corneal abrasions, the number one prevention, remember, is always to prevent. That's number one. We do not want people scratching their eyes, touching their eyes, gouging into their eyes. And as you can see in the image here, this is what people do when they wake up. They go, and the very first thing, they're not even thinking about it. It's just an instinct to just want to go and rub their eyes as they wake up. So what you need to do is hold their hands down gently and say, don't touch your eyes. You're out of surgery. You're here in recovery. Everything's going good. You're safe. But just keep reminding them, don't touch their eyes. Let them know that you'll wipe their eyes with a wet washcloth, but keep their hands away from their eyes, especially our kids, the babies, the tots, They just want to go right for their eyes. So you got to have someone on the kiddo, keeping those hands down. During maintenance phase after induction, anesthesia usually tapes the eyes closed to protect the eyes. But once they have extubated them, they will remove that tape, and now their eyes are no longer protected. And so we want to make sure that their hands aren't going up and scratching those corneas inadvertently. So upon emergence, the operative and the perianesthesia team is responsible for keeping the patient from rubbing their eyes upon awakening. So the OR nurse, the anesthesiologist, the PACU nurse, everyone's responsible to keep that patient safe and keep them from doing harm to themselves from scratching their eyes. Now, signs and symptoms of a corneal abrasion, what are they going to say? The very first thing is they are going to have pain in their eye. They're not even going to be able to open their eye depending on the degree of the corneal abrasion. They're going to have a teary eye. They may say it burns. That's classic. They also will say it feels like a grain of sand on their eye. That's classic as well. They may have photophobia, light sensitivity, so you will want to dim the lights if you can in the area, in the room, pull the curtain. And it's usually the very first thing they say when they wake up during phase 1 is that their eye burns or there's a grain of sand in there, and you immediately should think corneal abrasion. And then you need to notify anesthesia once you've identified this complication. You want to encourage the patient to keep their eyes closed so that they can rest their eyes. You don't want them focusing on their cell phone and catching up on their text messages while they were in the OR. They want to rest their eyes because you don't want to strain it trying to focus on something. You can also apply a cold compress to their eye, like a wet washcloth. This works really well to give relief, some temporary relief from the pain that they're experiencing. It won't take it all away, but it will give relief and maybe help with some swelling. And like I said, it cools. All my patients have always found a nice, cool, wet washcloth comforting. It also can block the light and give them some photophobia relief as well while you're waiting for anesthesia to come. Now, what anesthesia can do is topical antibiotic ointments are commonly ordered, and that can resolve the abrasion in 24 hours. Your anesthesiologist can also do a fluorescein stain with blue light. And what it will do is it will, the stain will dye the tear yellow. And then with the blue light, they'll be able to see the tear on the cornea. Remember, the cornea is the clear part of your eye, that outer protective layer that goes over the iris and the pupil. So it's coherent with from the sclera. And proparacaine eye drops. So this is an anesthetic, and it can be administered immediately for pain relief. Anesthesiologists will order this commonly, but it is not recommended for them to have a discharge prescription for this to take home. It's something that we use in the hospital only. And so it is an ophthalmic anesthetic. The onset is very quick, 20 seconds. The duration of time that it lasts is about 10 to 20 minutes. And if the pain is unrelated with the treatment, then anesthesia should order an ophthalmology consult for this patient, because there may be something else underlying that is not a corneal abrasion that needs to be addressed. So that kind of wraps up corneal abrasion in a nutshell. Don't ignore it because it's not going to go away. Your patients are really uncomfortable, and they may not even notice their operative pain because their eyes hurt so bad. So we don't want to have any vision damage, and we want to get this treated quickly. Don't let anyone poo-poo it. I've had some anesthesiologists just poo-poo it and not say it's anything, but it really needs to be looked into and it needs to be treated. And then if it's not managed, they do need to have an ophthalmology consult. So that wraps up corneal abrasions. I hope you liked it. And if you're interested in the course, that's kind of what you can expect in that format with me presenting in that top right-hand corner. I thank you for your patience. I know the course has been long awaited. It's taken me way longer than I thought it would be, considering I had health challenges And it seems like after COVID, everything just takes way longer than expected to get all the resources pulled together to make it happen. But it's coming. I'm so excited. So once I have that 2-week notification of when I'll be ready to launch, then the pre-sale will begin at a discounted rate. So you don't want to miss that. And if you want to get notified of that, go to PACUNursingMinutes.com. I'll put the website reference down below here. There you can go and sign up, and that is when you will get notified of the pre-sale with the discount. So you don't want to miss that. And as always, I thank you for my Patreons supporters. If you're interested in becoming a patron of PACU Nursing Minutes, then you can go to Patreon /PACU Nursing Minutes, and there you can look at the different levels of support if you're interested in supporting this channel and sign up. There are some bonuses with higher levels, and so just go and check that out. And I'd love to have you be part of the Patreon family. There's going to be some more things coming for all of those watchers here soon. I just thank you for watching the channel, sharing it with your friends and your colleagues. I am Nurse Kathy. I will see you again soon.